Now, each year, we commemorate World Tuberculosis Day on the 24th of March to raise public awareness about the devastating health, social, and economic consequences of TB. Also, to step up efforts to end the global TB epidemic. Now, remember, this year's theme is It's Time. Find the people living with TB. Now, we'll have a conversation with the Principal Health Nursing Officer of the Chest Center at Kolebu Teaching Hospital, and also other health practitioners at Achimoto Hospital. Let's do that now. Roland Walker had the opportunity to interact with them.
We're coming to you from the Achimoto Hospital here in Accra. Well, Achimoto also connotes that it's near the Achimoto School, the Achimoto Golf Club. As the statistics already indicate, we have about 4,500 people who tend to die from the disease. That's a concern for many of us. Back in 2018, we had the UN General Assembly deciding to give a certain indication and tax world leaders to ensure that they committed funds to ensure about 40 million people worldwide are given more preventive health as far as tuberculosis is related. But here in Ghana, there's a lot of work also being done by the Ministry of Health as well as the Ghana Health Service. Well, at the Achimoto Hospital, we decided to speak to some focal people. We'll be having some great interactions with the Principal Health Nursing Officer. And so the Principal Nursing Officer is Nelly Owusu-Arthur. Good morning to you.
Good morning to you all.
And then we have Dr. Ni Hansen Norte. It's a compound name, so you always have to add the Hansen to the Norte. Good morning to you, Doc.
Good morning, Roland.
But first, let me ask you, how serious is the subject of TB and its treatment and the cases that are recorded daily in our country?
Okay. Our biggest challenge in Ghana is that even though it looks like everybody is normal, we have quite a large proportion of people who have TB exhibiting literally no symptoms. That is the scary part, because TB is an airborne disease. So if anybody who has the disease is not showing symptoms to be easily picked up, then they are living in the community and literally distributing the disease to other people around them. So our biggest challenge is that we are estimating that every year about 44,000 new TB cases evolve in this country. Unfortunately, our health system is only able to capture just about 15,000 of them, meaning that we have almost 30,000 or 29,000 people with TB who are not diagnosed and living in our community. They are the people who are literally sharing the disease among Ghanaians in this country. And we need to do everything possible to find these people in the community.
Now, as a principal nursing officer, especially in public health, it also means that the responsibility will lie on you and your colleagues to do many of the work, not only at the treatment centers, but also in the communities. How's that going as far as the community treatment and the education is?
Yeah, we do OPD education as well as having an outreach program. We go to the community and run clinic, like taking the hospital to the community. At that stage, everybody in the community can wear anything and feel comfortable coming to wherever we are having the program to test for the TB. We don't do only TB alone. We do other screening, chest x-ray, HIV screening, because HIV is almost related to TB. So we take the hospital to the ground. A doctor is there to consult so that patient will be comfortable to tell whatever the problem he or she has. Then we have a screening tool to screen the patient to know whether patient is eligible for TB testing. Then we will do that, and we are able to come up with the diseases.
But it also means that at the community level, you need to then draw people out, whether it's from their household or maybe you have to use the churches, etc. How is that done?
Normally, when we have programs like that, you have to inform the people around. So we use the van to inform the community that we are coming to the ground. So we prepare their mind. If it's church that we are going to have the activity, we announce at the church to make everybody aware, to create the awareness so that they will avail themselves for that.
And you wanted to add something?
Yes, and in addition to that, what we are doing I'm coming from the private sector NGO, and we are working with the Ghana Health Service in the various communities. We currently have an intervention called the Know Your Lung campaign, as you can see.
Oh, okay. As we have it on your T-shirt. Yes. Know your lung campaign.
And the purpose of the Know Your Lungs campaign is to create community-based awareness. So we have community volunteers in the various communities. We are working in Accra Metro, we are working in Kumasi Metro, and these people are creating sensitization from house to house and interacting with people who live in these houses, telling them about the TB disease, asking them about symptoms related to the disease. And people who exhibit 1 or 2 symptoms are picked out, and a sputum sample is taken, and it is taken to the lab to be tested. So by this activity, we are doing what to pick cases from the community without necessarily people having to walk to hospital to be found. And we believe that as we are able to increase the scope of this intervention, it shall help us increase the number of TB cases we diagnose in our country.
I see, but for all the efforts that you tend to undertake, I keep hearing Accra and Kumasi. Does it mean that it's only restricted to these major cities and Greater Accra, but we have countrywide activities?
No, because it's a program that we are doing. Then after, it's extend to the facilities. The facilities will also take up from there, then do their own activities to go to the grounds. So for now, because it's a TB day, we have a special place to do it. Then after that, every facility like Achimoto is going to organize his or their activities. So they can go to the schools, community, OPD education. So it's after this commemoration, they will set up their own time to move around.
But I know that this should all fall within the whole scope of what the National Control Program may be undertaking. We have a National Control Program, don't we?
Yes, we have a National TB Control Program that is actively on the ground, working with civil society organizations that are in communities, working with the health system as in the private sector, the public sector, and with national policy and national support. Ministry of Health supports us. We have external donors supporting us. The whole idea is that we need to create adequate awareness around the country. So we use the health system itself, we use community actors, we take advantage of religious organizations, we take advantage of NGOs working in the community-based organizations to promote the idea about TB case finding. And then we get laboratories to support us to do TB case finding. So it's a holistic approach to TB case finding in order for us to be able to reduce the burden of TB disease in Ghana.
Well, the two of you just wait. It's good that you mentioned laboratories. So we have to go to the lab. We want to go there and get to find the practical work that is undertaken by the laboratory scientists, but more so get to know how some of the basic tests they do and whether anybody should be afraid or not. I have John Kwesi Emisa, laboratory scientist or technician. He's here. Good morning to you. This is my lenses. So yeah, so good morning to you.
Good morning.
And basically, what are the random tests that you tend to perform or undertake when you want to screen somebody, so to speak?
Okay. For somebody coming to do to be screened for TB.
Exactly.
You have to produce a sputum sample.
Sputum is what?
Sputum is a product that is produced after you've taken a deep breath and then coughed up.
So almost like a saliva, but the thick one.
Not a saliva. It's like, let's say, phlegm, the thick one. Like
some mucus or something else.
That is coughed from within your throat, not the one that we blow from our noses. Okay. So that sample is what we need. If the sample is not...
Even when you don't have catarrh, you mean?
No, even if
sputum is sputum.
Sputum is sputum, yes. Not saliva. We don't need saliva. If you bring us saliva, we'll not be able to get a result that we need for you. So we need a sputum sample. So once we receive the sputum sample, then we process it. We have staining, where we can use either the Nelson staining technique or fluorescence staining technique to be able to identify the sputum mycobacterium, which is microscopy. And then we also have the GeneSpec, which is the WHO approved standards that we are using now.
I see. So for example, what we have here is a specimen or a sample that you worked on, and these are the results?
Yeah, this is a result of a patient that has been processed. And This indicates MTB not detected. And this is a nucleic acid amplification test procedure that is used to identify the mycobacterium in the sputum. So a lot of process go through this machine, and then the result comes out.
So, for example, I'm seeing probe something negative and all that.
Okay. They are all checks. The instrument checks its probe. The probe is more like a metal that picks the sample, picks the reagents, and then does the test. So before the test is done, this has to be checked. The instrument does its own internal checking and then gives you the result. So once the probes are not passing, the results will not be correct. So our probes have passed, everything, our QC has passed. So now our result is authentic. So this patient is MTB not detected.
Meaning what?
Meaning the patient is negative. Okay. The mycobacterium was not detected in the sputum of that patient.
Okay. But usually, I know that sometimes people want to have their own mindset with the physical characteristics. You don't do that. You deal with what comes out, what you need to use for your investigation.
Yes. For us, the laboratory, our result driven is based on samples received. We don't use physical appearance and all that to do that. Yeah. So basically, with our sample, once we do the test, the result that comes is what we need.
How many, averagely, let's say, if you have to do the test, would you say be the positives you get, looking at the catchment area?
The positivity rates can be, quarterly or based on the season. It's usually seasonal. There are times you're not getting positives out, there are times you're getting a lot of them.
So if it's a season, when it's rainy season, dry season, or when cyclones are coming?
Usually when it's the dry season, when people are getting a lot of the upper respiratory tract infections, the cough, the colds, the catarrh, the sore throat, those are the times they are also coming, because that is when people cough and then you're able to identify them. Mind you, this mycobacterium can be in your system for a very long time.
Really?
Without causing any symptom. It is only when your immune system is down, then they also get to manifest. So this is what is done. Now, one thing, the beautiful thing about this instrument is also able to identify those who are resistant to the rifampicin, which is the first line of drug. So this instrument is also able to tell us a patient who is positive and resistant to the drug.
Well, thank you very much. Our chief lab technician this morning, and John Kwesi Emisa helping us do all that. But it's good that you're here. What's your name?
Gifty.
Okay. Gifty. And you're a lab technician as well?
Yes,
please. Now on the bench.
Oh, great. So you tend to look into the microscope?
Exactly.
Oh, I wish you the best for the morning. But we have to go back to Dr. Hansen Ni Naughty, okay? And then...